Hey guys, welcome back to The Dent Life. My name is Komal, and in this video I'm going to be diving in a little bit deeper and talking about how much dentists actually earn. If you like talking about money and you want to know how much it actually costs to become a dentist in England, then see my last video. But if you want to know how much dentists actually earn, which I think you will find quite interesting, then watch the rest of the video and you will find out. So like I've mentioned before in my video about what happens after dental school, if you want to work in the NHS, you have to do a year of dental foundation training. And if you don't want to work in the NHS, then you can go straight on to do private work, and all you need for that is a GDC number. So GDC is General Dental Council. So if you are all approved, you've got your degree, you've got the little bits and bobs, then you can go straight on to working privately. But if you don't do a dental foundation training year, you don't get to work in the NHS. So I'm going to be concentrating on the salary depending on the NHS and dental foundation training years, dental core training years, because that is the information that is kind of set in stone. If you do private dentistry, the salary varies so much. Like, it can be usually better, I'm assuming, but I haven't ever done private dentistry, so I don't know, but I've heard it's quite good. If you work in the NHS for the first few years, there's a set kind of number, and so I will get into the nitty-gritty of that in this video. So firstly, you have DFT, and you do this for a year, 5 days a week, and it's pretty much 9 to 5, so it's around a 35-hour week every week. And so you sign a contract to say that this will be your only job, so you're not allowed to have other part-time jobs while you're doing DFT, and I think that's because they want you to concentrate on your training and want you to become the best dentist you can become. So the salary for DFTs this year, so that's 2020, is actually £32,796 for the year. So that is about £2,700 before tax. And then when you actually take away the income tax, national insurance, student loan, NHS pension contribution, you get a little bit deducted. So you end up with actually around £1,700 a month. I know, it's really sad, like literally £1,000 a month goes into other things. Yeah, so basically one of the things you don't have to contribute to, so I mentioned income tax, national insurance, student loan, you do have to pay that, but you don't have to pay the pension, so usually the contribution is around £250 a month. So you can opt out of that, and then you end up with around £1,950. After all of the deductions, you end up earning around £20,400 in your training year. Okay, so then as I've explained in my previous video, after DFT you can go on to do either associate, so that's like a general dentist, or you can go on to do DCT, which is dental core training. So I'm going to talk about dental core training first because it's a little bit easier to explain. DCT is again 9 to 5, 5 days a week, and it's for the whole year. So you work about 35 to 40 hours per week. And once you start DCT, you are actually allowed to do work on the side. So for example, if you want to be a locum dentist on a Saturday, then you're allowed to do things like that. So the DCT salary currently is between £38,693 to £49,036. I'm assuming it depends on your location and other factors, but I'm not completely sure what the factors are, but this is the range. So if you work more than 40 hours a week, you are paid extra. If you work nights, then you get a 37% enhancement of your salary for that shift. If you work weekends or you're on call, then you get an allowance. So an allowance is just basically extra money for working weekends or on call, because you're actually just meant to be working Monday to Friday, and if you do the other shifts, then you kind of get a little bit of a reward for it. Then after that, you go on to DCT2, and then DCT3, and then speciality training, and I've explained all of that in my previous video, so go and watch that if you want to know more about it. And when you're in this phase, then you get about 80 to 100,000 pounds, but obviously those figures are not as set in stone. They change yearly, they change depending on the current climate, and obviously because of COVID I don't know what anyone's salary is anymore. But if you want to do more research about that, then go onto Indeed or something and check how much the salaries are. But yeah, basically it just increases for each year. So you do DCT1, you're probably on like 38,000. If you do DCT2, it'll be a little bit more, and so on. Okay, so then let's look at associate. So brace yourselves, because this is about to get really, really confusing, and it took me a really long time to wrap my head around this because there are loads of little terms that I'm going to be mentioning. I will try and explain it to you the best way I can. For associates, it works a little bit differently. So it works on terms of UDAs. So UDA means units of dental activity. So an associate firstly agrees with the practice on a few things. Firstly, the UDA rate, and that is usually about 20 to 25 pounds, and it's higher in places that have a higher need for dentists. And then they agree on a license fee, and the fee is basically paid to the practice owner. The fee is usually about 40 to 50% of the UDA. So for example, let's say you agree on £20 and a license fee of 50%, then you will get £10 per UDA. That will go into your pocket. And then you agree on a target. So that is usually around 5,000 to 7,000 UDAs a year. And then that's how it's all calculated. And also, if you fail to meet these targets that you've agreed on, then you have to pay some kind of fine, or your contract for the next year isn't going to be high enough because they basically think that you aren't able to meet the target. So that's basically how it works. Okay, so let's get into how the UDAs work. So UDA, which is units of dental activity, you have different bands. If you're over 18 and you've been to an NHS dentist, you've probably paid them money when you go there, and it depends on the treatment that you've received. So the bands work like this. Band 1 is clinical exams, radiographs, scaling and polishing, preventative care, things like that, and that is 1 UDA. Now urgent care comes under band 1, but that is 1.2 UDAs. That's urgent treatment like exams, radiographs, re-cementing a crown, up to 2 extractions, 1 filling. So that is band 1, but 1.2 UDAs. So then you have band 2, and that is simple treatment. So things like fillings, extractions, surgical procedures, root canals, which I don't think are simple, but they're in band 2. And the UDAs you get for that is 3. And then you have band 3. So that is complex treatment, so things that require help from a lab. So bridge work, crown work, dentures, and that is 12 UDAs. So the thing with this system is that it isn't about how many of these things you do. So if I do 10 extractions, it will still count as a band 2. If I do 1 extraction, it will still count as a band 2. So as a dentist, I get the money when the course of treatment is completed. So if I did simple treatment for a patient, then it'll be about band 2. If I did complex treatment like made them a crown or a bridge or things like that, then it will be a band 3. But there's no cap on how many I can do. Apart from the urgent treatment where you can only do 2 extractions and 1 filling, if you do more than that, then that goes into band 2. So that's basically how it works. I hope that made sense. I know it's a little bit confusing. Also, I forgot to mention that associates need to pay 50% of their lab fees, and then the practice pays the rest of it. Okay, so let's try and work that out. So for example, we already did the maths. We get about £10 per UDA at said practice, and we've agreed on a target of 7,000. We think we're pretty on board. We can do 7,000. So that is £70,000 per year as my salary, and that is pretty good. I'm happy with that. But then you have to deduct the lab fees and other stuff, so like tax and student finance and pension and all that good stuff. And then you're left with the rest of it. So basically in your head you're thinking you're getting a really good deal, like £70,000 per year. That's really, really good. But actually in reality there's a lot of deductions and a lot of stress added to the fact that you have to meet some targets. Otherwise you're going to have to pay a fine. So there is a little bit more to the salary for an associate, and as your experience increases, then obviously your UDAs will increase, the targets will increase, and your salary will increase. Okay, so that was a bit of a simplified overview of how much a dentist earns. I hope it made sense and solved the mystery for you, because honestly this thing about UDAs and DCT and salaries and targets and things, like, I literally didn't understand it until I still don't think I understand it fully, but yeah, I've tried to explain it the best way I can. But yeah, if you have any more questions, then comment below or email me. Don't forget to like this video and subscribe to my channel for new videos every week, and thank you for watching.